All right, 9:02. Dr. Shaw is here. It is time for our quarterly men's health segment, and I was supposed to do a spot for Dr. Shaw during the last segment, but we got really busy, and I figured, what the hell, he's coming in, so he'll do the commercial with me.
Let's do it.
So here we go.
Oh,
so hi.
okay.
I'm a little nervous. This is my first commercial.
What do you think of Austin Urology, Dr. Koushik Shaw?
I think it is the premier institute to have your testicles and the rest of your urologic parts evaluated.
But you don't
I'm biased.
But you don't just deal. Excuse me, Bob.
Oh, I'm sorry. I have a question.
But you just don't deal in men parts. You deal with ladies also.
Yeah, it's kind of a common misconception that we only take care of men, but women have testicles too. Kidding.
No,
no, but they have kidneys, so we take care of women with kidney stones, kidney cancer, urinary tract infections, incontinence, and all of those things. So women are entitled to have urologic problems.
I want to apologize.
Well.
I had a timer going for 60 seconds for your commercial, and Bob just hit his mic and reset the timer.
Well, I'm also on. No, I didn't.
Yeah,
my mic was on. I didn't touch it. My hand's in my pocket. Right here.
Somebody turned on a mic.
I have a question for Dr. Shaw.
Yes, sir.
Do you have any celebrity clients?
I do. I'm not allowed to discuss them, but some of them are very well-known, well-regarded radio stations.
Oh, okay.
In this very town.
But
I cannot mention their
that's
names.
intriguing.
Do you believe that vasectomies are still safe and reliable and no needles?
We do not use needles, so we use a pressure jet.
We don't have time for all this in a 60-second spot.
Yeah, so no
AustinUrologyInstitute.com. Call them today at 512-694-8888, 512-694-8888. It's AustinUrology.com, endorsed by Koushik Shaw,
himself.
who owns it, right?
Exactly,
All right,
yes.
thanks.
All right. Good job.
You have another
I think you
lady
got a career in this.
You have another doctor there too, right?
Yeah, Dr. Shashwa. So he's my practice partner.
Oh, it's a he?
Yeah.
Oh, so who was the woman I saw running around looking all doctor-like? Is that
she's my our nurse practitioner.
I would rather see her.
There's a lot of guys that do.
No, I'd rather see her than you from now.
She's seen me. I hope she sees me on Friday.
All right.
They're like, wait for him. He's coming in for the prostate exam. No, it's fine. I'll just have you do it. So,
is everything up and running now, Daniel? Yep. All right. Call us if you have questions for Dr. Shaw. We have a new phone number, 512-834-0937. 512-834-0937. There is no question off limits.
But you know what the amazing thing to me is that there's an inordinate number of guys, which is awesome, who get their medical knowledge and a lot of that urologic male health knowledge from listening to you guys, which is pretty cool. So that's why we're doing this, guys. So if you've got questions, concerns,
call us.
Any urologic
questions.
Any
Pains,
questions,
lumps, bumps. But,
ask us. Call in.
I'm playing this romantic music for a reason. Is that you and I really haven't talked since the last time we saw each other, and last time we saw each other, it was a
little special.
Yeah, I mean, you touched me.
Oh, did you go for?
Well, Dale, would you accept this rose?
Would you? Yeah.
Do you know what I love is that your sense of humor you've loosened up a lot because when you first came on the show, you'd go, oh, okay.
I was more nervous coming into this studio than I was doing cancer surgery. I'm not kidding.
That's weird.
I was more nervous because this is out of my element. Being
Bob
here,
and I
was doing that.
Bob and I get more nervous when we're doing cancer surgery because we're not qualified.
Well, touche.
Was it just me or did you spend a little bit more time in there than usual?
You're a special kind of guy.
Yeah.
You're a special kind of guy.
A lot more area, surface area.
And as long as when we're doing that prostate exam, if someone say you don't feel both hands on your back, it's all right.
I will say this though. I did notice because I wouldn't expect it. I knew we were going to do the fickle finger, which I needed. It's been a long time, and I needed that.
Yeah.
But I didn't realize we were going to do the NAD check, and I will say I did look down, and he had turned, and Dr. Shaw had turned his head.
Oh, that's very polite.
No, I think he turned his head because he couldn't believe how monstrous it was.
Well, when I look back,
you sure it wasn't just the hairstyle you have down there?
Thought he was in a disco. Anyway,
but one of the best memories I have is I will have from this place was the KLBJ medical clinic that we set up in the studio here using your banner.
I remember.
Using your banner.
We could do it again
as a partition,
and doing y'all's exams.
But you know what we should do for real? You know what we should do next time? For real, we should put it on company-wide email. That we're going to have a male prostate check and have sign-up sheets and have people come down, and we'll just like run them through.
September is Prostate Cancer Awareness Month. Let's do it, guys.
I want to say this though.
I'll bring the lube.
All joking aside, so I was telling you that I had not had my wife. We went in. We were trying to get everything done before your deductible resets. Phone's crashed again. I'm not going to be able to use the software, I guess. So I'll just put them on hold and I'll go to them.
We'll go live.
Yeah, but I hadn't had a colonoscopy since about 2004. And so you booked that for me, you got me in, and it was special treatment. And we should say this: is I went in and I had 4 precancerous polyps.
Yeah,
one that was pretty big size. They had to put a clamp in it, so it was really good that I went in. I'm doing my family tree, family history, and a lot of the death certificates from about 1910 on are online. And person after person, I saw colon cancer, stomach cancer, on down the line because people didn't get checked back then. So here's the part where we're not joking. I did go in to see Dr. Shaw. We joke about the exam, but he said, when was the last time you had a colonoscopy? And he gets you on that path. He didn't do the colonoscopy. That was Dr. Paradotti, but you got me on that path.
Kind of put you in the right direction.
Yeah,
and a lot of guys, don't see their doctors regularly, but I kind of say once you cross the age 50 mark, you got to work at it. I think you get a hall pass up to age 50, and you can eat your Cheetos, drink your beer all day, and not work out. But 50 onwards, you got to do the colonoscopy. You got to do all that stuff.
Because now I found out that I'm prone to those polyps. Dr. Paradotti says I have to have it done every 3 years.
Right.
Now, I will say this. I will pay the $250 to sit in that machine from now on because I'm never drinking that stuff again. That was
you did the machine.
No, I want to do the machine.
Okay.
That other stuff is you forget how bad it is. You forget how bad the Go Lightly is.
But is the machine in the same facility, or you have to go across? You have to run across town.
Who knows?
The machine it's at a couple of their centers, and you basically sit on a water fountain.
Yeah, I'm
down with that. Cleans out your innards, but you don't have to drink all that stuff.
You don't cramp all that long. You don't cramp all that.
That's what I'm doing.
I don't know. So I don't have anybody's name.
Do I have to have a colonoscopy to go sit on one of those machines, or can I just, after a heavy weekend of queso, head over there?
I think if the money's green, man, they'll do it for you.
Caller, what's your name?
That'd be the only thing he sees green.
Joe.
Hey, Joe, what's your question for Dr. Shaw?
Hey, I got a vasectomy about 13 years ago or so, and the wife thinks I ought to go get it checked every once in a while to make sure it stays. Is that legit?
Right, that's a great question. You know what? If you want to get it checked, we're happy to check it. It's just a quick thing to do. We actually quote the vasectomy success rate as about 99.9. So it is one of the most successful ways of or methods of birth control there is. Now, every doctor that you see will do their vasectomy in a slightly different way. Our intent is to make it permanent, but certainly.
Wait a minute. Are you saying these things can leapfrog across?
Well, say in my technique, we put a clip on either side. Plus, we use a heat seal. Plus, there's a segment in between that's gone. So, it's like that movie where he said, so you're saying I got a chance.
Right. Yeah.
So anything is possible, but in our experience, when you have the vasectomy done, you do those 2 at-home sperm check kits, and those are both negative, you're good. You're golden the rest of your life. Gotcha. So same I would say to you, sir, is that you're probably fine. But having said that, if you have any concerns or doubts or concerns, it's just a quick test. And you can
how do you do the test? Is it like a scope, or do you into a cup and check a count in a cup? Is that what happens?
You could do a count in a cup. Do your stuff in a cup and run it out to the lab. We actually have an at-home sperm check kit that you can do. It's actually you
don't have a place at your place where I could just go in and
yeah, we don't carry magazines, pal. It's not that kind of place. So it's actually like a birth, a pregnancy test for guys.
Gotcha.
So you just do it at home, and then a little science experiment test, and then if it's negative, you're good.
But the third thing you can do, sir, is get a really young girlfriend and see what happens.
There you go.
But is your wife coming home and saying it must be you? Then there's probably another issue. So
no, she just got off her birth control and she was worried about it.
So it's probably a waste of time.
Yeah. More than likely, you're going to be just fine.
Thanks,
but obviously, no one can fault you for being.
We have
careful.
never had that question before, sir. Thank you.
That's good.
Cool.
Never a bad idea to keep your wife happy, though.
Did you give your staff the rest of the week off, like we were talking about?
Oh, man. Oh, at Christmas?
Yeah, remember? I was in there, and I said, you're going to make them work all week?
Yeah. I think they had the for Thursday or Friday off.
They like it.
Yeah. Not the whole week.
They like
so
they got important work to do there.
Yeah.
Yourself.
Hi, what's your name?
Hi, my name's Brad.
Hi, sorry, Brad. My software doesn't tell me who you are because it's crashed again. So what's your question?
I had a question for Dr. Shaw about the smell of urine.
Okay.
I'm 28. I kind of drink a lot, maybe 3 or 4 times a week, and binge on the weekend. I was just wondering if a strong odor from urine would be just your liver, chugging along, or is that a precursor to something else?
Is your urine kind of a real greenish yellow color, or is it just kind of just like a lemonade color or white, or what does it usually look like?
I try to hydrate as much as possible, but like a light yellow usually.
Okay. As long as it's a light yellow, that's kind of the normal color. Of course, we're happy to see you do a urine analysis and do some liver function tests on you with the drinking, and just to make sure there's also not a urinary tract infection. But the things that make it smell would be a urinary tract infection. That would be the most common source. It's unusual for a young, healthy guy to get a UTI.
Asparagus.
I was about to say I had some asparagus last night.
Doctor,
That will make
if
it
you don't
stink.
mind a second opinion here, I would suggest that you do you have a buddy that's healthy?
Yeah.
Well, have him pee at your place and see if you can smell his. Maybe you just have a heightened sense of smell.
I didn't think of that.
I think the question here does
Yeah,
urine,
no, it smells weird, but how's it tasting, my friend?
does urine smell ever signify disease?
Well, sometimes it can, so urinary tract infection will do, but if it has an unusually greenish yellow color is probably the best way I can say it, almost like a what is that stuff called?
It's antifreeze.
Yeah, antifreeze or Mountain Dew.
Yeah,
that's the other one.
Yeah.
Sure, it could actually signify some liver disease, but having you could happy to see your primary care doctor, or you could see us and we could do a quick screen. Any history of kidney stones in your family also?
Oh, no. But, on another note, my dad also has what Dale has. He has AFib.
Yeah, that's a heart issue, but that's
It could just be. It could be after a night of really cranking a bunch of drinks. You're just really dehydrated, bro.
That can happen too. So you guys are all junior urologists.
Yeah, well, we're working on it
over all these years, man. I love it.
512-834-0937. If you really are in question, make an appointment. And Dr. Shaw usually agrees to see you.
I thought my question was pretty good. You have a control. You
have
someone else's pee, and if it seems strong to you, then it's your nose that's
a good idea.
overactive.
Exactly.
How many cancers are you seeing a week?
We see a couple a week. Anything to from prostate cancer to bladder cancer to kidney cancer.
How do you break that news to somebody?
The good news is for most of the cancers,
Do you put on your Patch Adams nose before you go in there?
The good news is, especially for prostate cancer, we talk about that where we discuss screening at the age of 50 to 55 and yearly after that. But if you catch it early, most of the cancers that I detect in urology, we cure them of it. So the good thing is early detection.
No, but how do you break it to people?
That's how I kind of tell it. It's a bad news, good news thing, sort of thing. Hey, the bad news is you've got prostate cancer, but
you
the
just
good
say
news
it like
is
that. You go, hey, I got some bad news for you.
I do, but I tell them I've got some bad news for you, but I immediately follow by, but the good thing is we're going to cure you of it.
Yeah. Right.
I follow it right up with that, and that's how I break it to them.
Gotcha.
Because the bad news day and the bad news thing is you've got some sort of fill-in-the-blank cancer, and you're going to die of it. Thankfully for me, that's not a situation we have very often. We catch them early.
The good news is we're going to cure you, and you're going to get a T-shirt.
Do you ever see penis cancer?
Penile cancer, I haven't seen it in about 15 years. I haven't seen
just because you turn your head.
The thing is with penile cancer, it starts with a wart. Okay, this is a good thing for the listeners too. It's a wart that continues to grow. It then subsequently grows so big. I mean, I'm talking about the size of a mushroom or a small cauliflower. It can get that big. You've ignored it that long, and it's burrowed deep into the inner tissue.
And you usually get that by smoking through your penis, correct?
Yeah, that's how most
and it's to be but I have to say you tend to see it in populations where it's where there's a lot
not necessarily in the West.
Poor medical care, poor access to care, and all of those things.
Would you say that generally once a guy sees a wart growing on his penis, he goes to see a doctor pretty quickly?
Well, believe it or not, there's a lot of guys that don't. That's incredible. Either you're embarrassed to check or you don't know what it is.
I have an embarrassing thing I'm going to tell you.
Or you're just happy to finally have some added girth.
Yeah. And real quick for the guys out there, if you have a wart or you feel like you have a wart, you could usually see your primary care doctor. You could see a urologist. You can see a dermatologist. You can freeze these things off. There's topical meds. But the thing is, if you leave them on with your partner, you're setting her up for HPV. So which can lead to cervical cancer, which is why they're doing a pap smear. So you're setting your partner up for a cancer by ignoring that. And you can spread with intercourse and scratch and itch and all that stuff. You can spread those warts up and down the shaft of your penis. If you got that stuff on your wiener, go get that checked out.
Can you call me later? I just realized something I need to ask you.
Private.
Yeah, I thought it might be for a dermatologist, but I'll ask you anyway.
Sounds good.
So
everybody can hear that.
What?
Everybody can hear that.
It was live. It was live.
Caller, hello. What's your name?
Luke.
Hey, Luke. What's your question?
Hey, I actually got my vasectomy done just before Christmas.
It changed your voice.
Yeah. It did. Gave me an accent. Yeah, but I had a question for him about actually getting a colonoscopy. My father passed away of bowel cancer, and so did my grandfather.
Uh-huh.
I am now 35 years old.
Wow.
I had somebody tell me, another doctor tell me, hey, don't worry about it until you're about 40.
Uh-huh.
But at the same time, I'm sort of getting a little bit, I really want to get it done. Would you recommend me trying to get a screening soon? Or?
Yeah, 110%. If you call my office, there's many people you can see in this town. We've got some of our favorites who will take great care of you. You can call our office and we'll set you up with that. But I actually have a personal friend of mine who was diagnosed at 43 with colon cancer and was already metastatic, and he's 46, 47, and is going to die of colon cancer, metastatic. So it's one of those things. We talked about, prostate cancer catching early, curing you. Colon cancer, once it gets out of there, is a terrible
But with the colonoscopy, here was my question during my colonoscopy, and call his office. What's your first name again?
It's Luke.
Luke, call and set up an appointment, because it sounds like it runs in your family. But
and there is genetic screening.
When you do the colonoscopy, which is looking at the large colon, what about the rest of the intestines?
Well, typically colon cancer will be in the large bowel, the colon versus small bowel. And real quick, for you, Luke, is they do genetic testing. So I think you're one of those guys, if you've got two family members who died of it or had aggressive colon CA, there's genetic testing that can be done. And 110% I would get a colonoscopy, and I would do it early if I were you.
So are you going to call him today, Luke?
I think I will.
AustinUrologyInstitute.com. 467. No, that's Cap City.
Yeah.
What's the number?
694-8888.
Call Cap
But
City.
also Cap City will help you out. They'll put anything up there you want.
Thanks, man.
Yeah,
All right, I'll see you. I'm going to give you. I'm going to give you all the number again. 8340937. 8340937. Or
that's our number.
Or the old number 973-8300. Because I'm going to do a spot here while we wait for more questions. We have a couple of people online. Hang on. I'll go to you. All right, my wife wanted. Well, I don't know which Luke that is. We're not going to identify him. This is private. There's HEPA laws in here, honey. I don't know if that was our friend Luke.
Air filtration.
We're talking to Koushik Shaw, who I can call a friend now, because we're intimate.
You guys are awesome.
Very much so.
It's amazing. Yeah,
I will say this though. It is weird when you go to a doctor who you've become friends with, and it's time for that check. I know it is. It just is. It just is. It's kind of like
it's another day at work for me, man.
And I kind of wanted Amanda just to stay in there, Then
your wife was watching it.
That's
and then
a
it got
weird
awkward.
decision, though. That's a weird decision. Does she step in or step out?
Right.
All right. I don't know who's been on hold the longest because I can't see you. I apologize, but I'm getting to you all as quickly as I can. Hi, what's your name?
Hey, it's Ryan.
Hey, Ryan. What's your question?
All right. I've kind of been noticing that sometimes my semen has kind of a yellow tint to it.
Okay. What's the diagnosis, my Drew over here?
Diet, perhaps?
Asparagus?
I wasn't going to throw asparagus under the bus.
You still got some
broccoli?
Still got some urine in the chamber?
No. So what it is, if it's kind of yellowish or lumpy or any of these, that it's not white, that could indicate a infection in the prostate. So the prostate secretes about 99% of the semen, the ejaculate. So and 1% is actual sperm that joins up from the testicle and the vas deferens. So it could indicate an infection. So what I would do if I were you, come and see us, prostate exam. What we'll often do is send off your stuff for a culture and see what it grows out. And if you need to, we can just put you on a course of antibiotics, and it makes it go away. And some people, sometimes it burns or stings when you ejaculate. Is that kind of a symptom of prostatitis or infection in the prostate? And sometimes it'll actually affect fertility. That's another reason we'll treat it. Sometimes it might just be like you, is like, hey, I just noticed the color is off.
Do you have people do it at home and then rush it over to CPL? Is that how it works?
That's it.
Oh God,
you know the deal. You know the whole deal now.
Excuse me.
Now, what are these infections? Are these infections something that could grow into something worse, or is it just sort of a routine thing, like you got a cold in your beehole?
It could be like that, where it's just this asymptomatic infection, right? Not a big deal.
And it
but
goes
some
away
people it'll cause fertility problems, right? In other people it'll actually burn and sting. Some people are like, man, I can barely sit down because my prostate hurts.
All right,
so
you got it. You got it, man. Thanks.
Thanks.
Thanks for calling, brother. Hi, who's this?
John.
Hi, John. What's your question?
Well, so my girlfriend wanted me to actually ask someone about this, so I figured I would. Sometimes whenever I have to go pee, it just hits me real fast. There's no building up to where I always
the urgency.
How old are you, man?
I'm 22.
Oh wow,
okay.
That's okay.
Is that bladder?
I'm gonna have to defer to
bladder
your doctor.
spasm.
yeah, you're picking up, guys.
I defer to the good doctor on this one.
Yeah, so it just hits you, and you just have to bolt and make it to the restroom.
You drink a lot of caffeine?
Yeah, I don't drink soda at all.
Was it?
Yeah. You don't drink soda?
What about tea?
I don't drink soda. I don't drink coffee.
Okay. I
No
drink a lot
teas?
I drink a lot of tea, and that makes me.
No tea.
Okay.
No tea either.
Any medicines or multivitamins or anything?
No, none at all.
Nothing. So it just kind of isolated urgency and frequency. How long has it been going on for?
Well, it's been kind of off and on, for most of my life. When I was a kid, I had bladder issues. I actually had surgery when I was really young.
What kind of surgery?
I can't really remember. I was like 5.
Oh, did you have bladder implants? Get a couple of D's in there.
Should he ask if your parents are still alive? You probably should ask them.
You should ask them, but you should come see us. Yeah. And the reason being is if you had some sort of bladder surgery, that can set you up for scars or strictures or narrowing of the urethra. And the sign of that your bladder's acting up with urgency and frequency could be the sign of something else. In your particular situation, I mean, it's rare for anybody else who's listening, but with a history of prior bladder surgery, you should probably come see us and have us evaluate it. Now, for the other 98% of people who have the same symptoms, Coke, coffees, teas, Powerades, Gatorades, all that stuff, it's really not good for you.
Have we asked you that? We've asked you this question before.
Yep.
But can you settle this for us once and for all? It was asked on another show. This one's kind of a iffy question.
Go for it.
In pornography, when women claim to
ejaculate.
Is that an actual thing or is that urine?
That's urine.
See,
that is urine. I've seen that video, and I was like, I replayed that video. That is pee. You're being pissed off.
Were you arguing? No, who was arguing with me on that one? Or maybe it's another show Daniel and I listened to. But it is. It's so you're just basically watching. That's
a unicorn. It's not real.
Yeah,
it's not
okay.
Real.
Wow.
Well, there goes that.
So that's it.
Wow.
That's it.
You can.
That's disgusting.
You can remove that bookmark
from
the internet.
You can now sleep well at night, man.
Wow. No, go ahead.
Daniel,
what's the question, Daniel? Hang on, caller.
It just seems to be very clear. Always clear.
Well, yeah, but after sex,
have
you ever noticed that you have to go pee and it's super clear and it's your body? It's your body's way of cleaning out what's just happened, right?
Sometimes you'll have a reaction that you need to urinate right afterwards.
Always.
But, yep. No, in some guys, believe it or not, some of the sperm will kind of hiccup into the bladder and they pee it out afterwards. But you have to be on certain medicines. Don't
we have a sound effect from Kingpin that explains some of the?
No, I can't find all that stuff. We're running out of time.
What is it about good sex that?
That's so that's the final word on that.
The final word.
Is
you're getting
it's leaking.
So can you get rid of one of your subscriptions?
No,
on your credit card right now?
That has never done it for me, and I've always been suspicious that that's what that is.
All right.
That's what the
caller.
deal is.
Hello.
Hello?
Yeah, you're on.
Sir.
What's your name?
All right, this is Chris.
Hey, Chris, what's your question?
So, well, I've seen this kind of movement towards, hormone replacement therapy, testosterone.
Yep.
From a traditional urology perspective, what's your thoughts on that?
It's
something worth looking into.
Yeah, it's a good question. Say about 10 years ago, 15 years ago, when I first started practice, that was 0% of my practice, like zero. No, didn't see anyone. It is now officially about 15-20% of my practice, just because it's just kind of something that everyone is aware of. Now, the deal is when you were about 15, 20 years old and you're just horny as all get out, your testosterone is about 700 plus or minus. And there's about a 2% decline per year, which is just an age progressive decline for all of us. And so the deal is what I realized, and that's just natural history. But what's happening, in your 40s, 50s, 60s, there are a lot of guys that are remarrying, or whatever's going on. They're still dating when they're 80. Yeah. And the thing is, that people don't want to get older, and you're wanting to do the opposite. You want to get healthier, you want to feel better, you want to have more sex. So people want more of all of these things when the body's kind of doing the opposite. So
you don't want to gain weight. That comes with low T, right?
Yeah. So, what I tell people again, starting at that age 40 to 50, you got to earn it. So I tell people, a lot of my guys come in with these complaints. They all have the beer belly. Is you got to clean up your diet, reduce the carbohydrates. Sleep is very important. 7 hours of sleep a day at least. Eating well, you got to do all those things. But we do a metabolic screen. So we screen you for diabetes to make sure there's nothing going wrong. If you feel that you're feeling worn down, tired, exhausted, you're picking up a belly despite doing the best you can. So we'll actually screen your screen your labs, check, do a blood screen, a screening for blood sugars to make sure you're not diabetic. Check your cholesterols as well. We'll check your B12 levels to make sure your vitamin levels are okay.
Can you stop for a second? Because I can just tell you from experience. So it's not one of the, Dr. Shaw's not one of these fly-by-night things, because I went in to look at testosterone, and he made me take blood test, and my blood test came back positive for being a woman. No, my blood test came back with several markers, and he said, I'm not doing anything until you go see an endocrinologist. So I still have to get tested again and come back and see. I had a vitamin D deficiency, and then there was blood sugar issues, and so but the cortisol. I had a cortisol problem that was probably from those epidurals in my neck. But the point is, he's extremely thorough. He doesn't. You can't walk into Dr. Shaw and just go, give me a shot. Give me the testosterone. He won't do it.
Yeah. So. And we'll do it if you have to, but we're going to check for everything else too.
Yeah. Thanks, buddy.
Right.
And real quick, I just want to put one word out there. He had brought up another thing, is that when it comes to testosterone, one of the dirty secrets about it is if you supplement with testosterone, whether it's shots, injections, pills, gels, you're going to actually take over your body's natural function of testosterone. Your body will stop
making it itself.
Exactly. And then you fast forward 1 year, 2 years, 5 years, you're going to have little squirrel nuts that don't make their own testosterone. Now you're stuck taking this thing for the rest of your life. Wow. So I see a lot of my workout dudes who are 25 and they're cut like a rock and chiseled, and they're on testosterone. They have little squirrel balls because they've been on supplementation.
Did someone say little squirrel balls?
So I
really. I'm Pop Squirrel. I heard squirrel balls. I'm sorry. I'll go away.
That's awesome.
I went to a clinic.
So
it wasn't.
Be careful.
It wasn't
guys.
your
be
place,
careful.
and I took some shots for about 3 months. I don't know why. I was a little crazy trying to find a quick fix. And I started growing a boob after like 3 months, like on one side. Now I have river rocks now, as Dale will attest, but it's gone down. But like one side was like getting bigger than. I'm like, something's not right with this.
Right.
Something's not right.
Right.
I'm either getting too much or something's. I
was reading about that the other day in a workout magazine. They call them bitch tits. Maybe you guys can explain to me.
I don't know.
What that means. But anyway, what's happening is that extra testosterone is being converted to estrogen.
Yes,
which is now causing that to happen.
Yeah, so I got off of that real quick because I don't want one of those.
Yeah, and then some of my workout guys, you can get them the supplements online. They take estrogen blockers. I mean, it's a three-ring circus.
Yeah, I don't want to do it. Natural's always better if you can do it.
I don't think I've heard Shaw be this saucy before.
I know.
He was drinking earlier tonight.
I also thought I'd killed.
I was just curious about that word I read.
Hey, caller, what's up?
Hi, this is Mike.
Hi, Mike. What's your question?
A friend of mine caught very early on prostate cancer. He didn't find it by a doctor doing the finger, so I wanted to ask about this, and I'm probably calling it wrong, but he had his PSA level.
You got that right.
That's part of it. Yeah.
Okay.
Yeah.
All right. So he found out it was 4, and his brother had 400 and died of it. So is the PSA better than checking with the finger? Is that the route?
Your phone sounds weird, so I think I heard you say that somebody had a test that was a 4, but his brother had a 400 and it ended up dying.
Do you want a low number or a high number at PSA?
Low is typically good. So you actually, the answer to your question is that you actually need to have a prostate exam plus a PSA. So the prostate exam can feel, we're looking to feel any nodules or bumps. So it's like a woman doing the breast exam, and if you feel it, it's more of an advanced cancer more than likely. So, but just imagine a woman also gets a mammogram to find lesions that you can't feel. So the same thing for the guy is, hey, you got to do the exam, but you also got to check the PSA, because I will tell you about 75% of the time the exam is normal in people with prostate cancer, but in 75% of cases, it's the PSA that gives me the alert. Hey, this is increased.
Is your body fighting something? What is a PSA? Is it a blood level or what? I don't know what a PSA is.
Yeah, so PSA is prostate-specific antigen.
Oh, okay.
So it's something that it is actually secreted into the bloodstream as a marker from the prostate. But it's increased because of 3 things. 1, it can be increased because of cancer. 2, because of infection or inflammation. And then 3 is for the size of the prostate. So the bigger it gets, the more prostate the PSA it makes.
We got room for one more.
But getting annually screened after the age of 50 to 55 is the right thing to do. So for your friend, before it got to 400, it started climbing from 2 to 5 to 10. So you got to catch it early.
All right, caller, what's your name?
Michael, this is really quick. Back in my younger days, there was a situation where, I'm going back to the girl thing that we were talking about. Isn't it when to become excited or something, there's lubrication that happens, before, and
Michael really wants a squirt to be squirt.
No, that's what I'm saying. I'm just asking if
I know what
regular,
you're saying.
Something else happening when they're just regularly lubricating or something.
For the guy?
No.
Girl, it's from the question
really
earlier
about
is it urine or not?
Yeah.
And that's normal. You'll have like a little, like say in men, it's like a pre-ejaculate.
It's urine, dude.
So you've got
I know the afterwards.
Yeah.
But
for women, yeah.
No, women lubricate, but they don't. Yeah. It doesn't fly out of them. So
when they were with me, it did.
I know. I know it's disappointing. I know it's disappointing, Michael.
He's just bragging. He's bragging.
Thank you, man. It's always good to see you. You loosen up. Yeah. You have so much fun now.
It is fun.
Now I want to get my testosterone checked again.
And before I used to just feel like I was here answering the questions by myself, and now I've got all you guys to kind of.
And
you've loosened up as junior urologists as well.
Thank you. Where's
the copy?
We want our certificate.
So call Dr. Shaw and set up an appointment if you have any questions. If you were afraid to call in,
we're scheduled for Friday, Dr. Shaw. You and me.
What are y'all doing? I want to come in.
You and me. We're not going to lunch or dating or anything. I've got a long-standing appointment that's coming up.
Yeah, I need to get checked again to see if I'm ready for something.
Have my lab done,
but 694-8888, and as you often say, it's not the painful lumps you worry about. It's the ones that are least painful. Yeah. Something new.
It's better to come in too early than to come in too late.
Oh, it's Matt.
All right, thanks, Dr. Shaw.
Yeah, thank you, guys.
Good to see you. We'll
Appreciate
see you in a few months.
Yeah, take care.
Maybe before then, Bob will see you.
Yes, sir.
Appreciate